Today we're going to be looking at cognitive behavioral therapy and process addictions. So what is a process addiction? According to Grant, Schreiber, and Odlog, process addictions occur when there is an inability to resist an urge or drive resulting in actions that are harmful to oneself or others. A few examples of process addictions are gambling disorder, shopping addiction, internet addiction, problematic online gaming, cybersex addiction, pornography addiction, sexual addiction, addictive eating disorder, exercise addiction, and work addiction. So, what is cognitive behavioral therapy? CBT focuses on how you think about yourself, the world, and other people, and how your behaviors affect your thoughts and feelings. CBT helps to build a set of skills to change negative, unhealthy thoughts and behaviors through empowerment. It brings awareness of thoughts and emotions, identifies triggers, improves feelings, and provides coping skills to restructure thoughts. So, what does CBT help? CBT helps a few different psychological disorders such as anxiety, depression, stress, eating disorder, psychosis, obsessive compulsive disorder, post-traumatic stress disorder, bipolar disorder, and trauma, all of which can co-occur with a process addiction. In circumstances of co-occurrence, CBT can address the underlying reasons for addiction and aids in preventing relapse. CBT also helps to empower clients to identify their own emotional behavioral experiences, manage how their thoughts, feelings, and behaviors interact and influence one another, develop self-awareness through monitoring themselves, and shift beliefs about themselves and about the world. Now, a major component of CBT is that thoughts, feelings, and behaviors are connected in a way that one influences and is influenced by the others. So basically, feelings are impacted by your thoughts and behaviors, and your feelings impact your thoughts and behaviors. An example of CBT helping change perspective would be that, say that a client sees a friend and thinks, oh my gosh, they're ignoring me, they don't like me. CBT helps by changing that negative thought to a positive thought. So thinking, hey, she looks really wrapped up in themselves, maybe she's got something going on. CBT also helps to bring a focus to cognitive distortions. So a few examples of those would be all or nothing thinking, which clients tend to view situations in black and white categories. Overgeneralization, so viewing a recent negative event as a never-ending pattern of defeat. Mental filter, which dwells only on the negatives, and disqualifying the positive, so insisting that your positives don't count. Lastly, jumping to conclusions. So the client assumes their thoughts, feelings, or beliefs are true without any other supporting evidence. So how effective is cognitive behavioral therapy? So CBT treatments are usually of shorter duration, lasting anywhere from 6 to 8 weeks to 6 months. But that makes many people skeptical about how effective the treatment is. This graph shows CBT being the treatment of choice for many different psychological problems. It is also noted that 95% of the patients from this study relapsed after discontinuing their medication. However, the CBT treatments had the lowest relapse rates of any of the psychological treatments. Can there be any problems with CBT? One is that it is not a quick fix. The therapist cannot do it for you. The therapist is simply there as a guide. It can also be difficult to stay motivated, but all forms of therapy can have the same problem. You have to confront the problem, which can lead to feeling anxious for a short amount of time. And lastly, the client is in control, which determines the duration of treatment and its effectiveness.